Hi, I'm Sailor Wilkinson, and I am a senior nursing student, and I'll be talking about health outcomes in rural communities and how we, as healthcare workers, can kind of help bridge the gap between rural and urban communities and the health disparities that happen in these areas. So, first of all, what is a rural community? A rural community is a community that is usually a little bit less populated and is spread out over a greater distance. And these areas often lack essential resources like general health care providers, therapists, and specialty physicians. So, here I have a little statistic that kind of helps put rural communities into perspective and just how common they are. So, more than 46 million Americans, or 15% of the population, are located in rural areas. So, rural communities and healthcare, how does this affect health outcomes? So, in the communities, most of the problems stem from lack of resources. Since things like good general healthcare providers are often lacking in these areas, the members of these communities lack the preventative measures such as screenings, vaccinations, education, things like that. Without someone to guide them and help educate them, they often don't gain the skills to be able to adequately understand the importance of their health, and they don't gain that essential health literacy. So here we'll talk about the health outcomes for rural communities. So some of the health outcomes include higher mortality rates, lower life expectancy, higher percentage of preventable diseases like cancers, heart disease, hypertension, things like that, and higher prevalence of cancers and obesity, which I kind of already said, but those are two main ones that we often see. And so unintentional deaths are 50% higher in rural community populations, which I thought was a really interesting, sad statistic that just really helps put that into perspective and helps you see just how much these populations are affected when their healthcare is not readily available for them. So, how can health outcomes in these communities be improved? Resources. So that's the big one. Make more resources available. And the other ones kind of fall into resources. And obviously, these aren't the only things we can do as healthcare workers to improve health outcomes, but these are some of the big ones and the ones that come to mind and that I found the most research on. So, resources, make those available, like I said. Educate the people in these rural communities. Educate these communities, help them understand how their bodies work, and help them improve their health literacy so they're able to really understand how things work and advocate for themselves in the healthcare settings. And then provide prevention methods. Get healthcare workers out to these communities to provide prevention interventions such as education, screenings, vaccinations, things like that. Will make a really big difference on healthcare outcomes. So, takeaways. The biggest things to take away from this presentation is that rural communities can be a very vulnerable population that needs people like healthcare workers to bridge the gap and really get out there and give them the care they deserve and advocate for them. Okay, so here are my resources. That's all I have for you today, and I hope you learned a little something about health outcomes in rural communities and can take something away from this and help change it. Thank you.